Hi everyone, Namaste. Today is our case history part 2 video. Okay, so as we already did 5 sessions of psychology, and in 5th session, I was discussing with you all about case history, how to take a case history, and in the case history part 1, I have discussed about demographic details, chief complaints, precipitating factors, and the history of chief complaints. Now I'll be discussing with you about remaining headings like physical and medical history. So in physical and medical history, you will be taking information about his previous physical illness, or if he has any present physical illness, that details has to be taken, and when it started, since when he is having these physical illness, and also a type of illness you should mention. If there is a episode of any head injuries or injuries to our body parts, and if he had undergone any of the surgeries or he had any fractures, and whether the treatment is continued or we had taken treatment and it stopped, that and all details has to be taken. And even you have to discuss, or you have to take information about whether he is a diabetic, whether he has a BP, whether he has a thyroid issue. So all the physical illness issues has to be mentioned here. Okay, no? Okay, then we'll be discussing, or we'll be explaining or taking information about the past history. Past history, as I have informed you, history of chief complaints, in which you will be explaining about details of the chief complaints. But here the past history is a complete detail of a life history of a person. Okay, so from the birth, then education, then social status, then marriage, his occupation, then if he having any mental illness before this, or is there any episodes of other illness, so all those things has to be explained. Okay, so by birth to till date, so he came for treatment, he has these issues, no, till date you have to explain in detail. That is a past history. And along with that, if you have not mentioned, if you have not felt there are chief complaints, like if he has a problem with his sleep, with appetite, with personal hygiene, with social interaction, if you didn't mention these things in the chief complaints, you can mention these things here. In the past history, you can mention the symptoms, like he used to be depressed, he doesn't mingle with the people, he feels very active, at times he acts so hyper. That and all has to be mentioned in past history, and you have to explain it. Okay, then after the past history, we will be discussing about the family history. In the family history, first you should write about family tree. So regarding the family tree and regarding the diagram of family tree, we will be releasing a different video. Okay, but family tree, in family tree you should use some diagrams, like you should use some square or a circle or something. Okay, few diagrams to mention about a family. Okay, there you should write two family trees if a person is married. For example, family of origin, where you will be explaining about his family of origin, about his parents, about his siblings. And family of procreation, where you will be writing about his marriage, like about his married couple, or about his children, extended family. Okay, so if a person is married, then you should write both the diagrams, that is family of origin, family of procreation. If he is single, then you can write family of origin. Okay, then you should mention each person's name, age and occupation, and also about their physical and mental illness. Okay, then you should mention about the consanguineous marriage among the parents. Among the parents, okay, it is not about the patient's marriage, it is about patient's parents marriage. If they have married within a relationship, then that is consanguineous. Within a blood relationship, then that is consanguineous marriage. If they have not married within a blood relationship, like his parents, father and mother, married within a relationship, then it is consanguineous. If they are not married within a blood relationship, then it is non-consanguineous marriage. That has to be mentioned. It is said that, like in a consanguineous marriage, if among a consanguineous marriage parents, the children has chances of getting a more chances of getting mental illness or physical illness. That's why we'll be clarifying about these things. And then family history of mental illness, other than the family person, other than his family of origin, other than his family of procreation, is there anybody who has a history of mental illness, like his grandparents, like his maternal uncle, like his paternal aunt? Is there anybody who is having in what a history of a mental illness? So that has to be mentioned. After family history, we will be discussing about personal history. In personal history, you will take information about birth and type of delivery, so whether it is normal or whether it is cesarean, whether it is a full term baby, or whether the patient is a premature baby, that and all has to be mentioned. Then developmental milestones, where you will be mentioning at what age child started crawling, at what age child started sitting, standing, walking, babbling, speaking, all those, the age of that particular milestone attained, that has to be mentioned. If it is delayed, that also has to be mentioned. After developmental milestone, you will be discussing about childhood disorders. So whether he had any epileptic issues, or whether he had a severe Nile wetting, bedwetting, jaundice, typhoid at a childhood. So childhood disorders has to be mentioned under the personal history. Then about educational history, like till what standard he had studied, then how he was in the studies. Then occupational history, so where and all he worked, what was his work experience, everything, whether he had a consistency in the work, that and all has to be mentioned. Then if he is married, or marital history. If a patient is a female, then you should mention about the menstrual history also. So all these things comes under personal history. Then premorbid personality. Premorbid means before the illness how he was, the personality before his illness. For example, you will ask with the parents, since when he is having this problem, they may say like since 1 year. So before 1 year how he was behaving. Some may say he used to be very active, he used to be very fine, had a good adjustmental skills, but after this illness, after these 1 year, he had changed a lot. He is like very dull, depressed, having irritability, that and all. Okay, at times it may be a same kind of personality, like since beginning he is like this only. Parents may say since the beginning he is very quiet, dull, doesn't mingle with people. Even now also, after the illness also, he is maintaining the same personality. So premorbid personality, how he was before the illness, that has to be mentioned here. Then treatment history. Okay, this is the last heading of the case history, where you will be mentioning about his previous treatments. Okay, maybe details of the treatment taken before this present treatment. So where and all he went, which and all hospital he went, what kind of treatment he had taken, whether it is ayurvedic, whether it is allopathy, whether it is homeopathy or faith healing. He just went to pandits, he just went to guru, and he had just taken assurance from them. He had stayed in the temple, and after that he became better. So what was the history of the treatment before coming here? And if he had taken psychiatry treatment, then who, with under which psychiatrist he had taken treatment, how was his response, which hospital it is, whether he stayed in the rehab centers. Okay, after coming from there, how he was, for how many days he used to be fine, that and all has to be clarified. The duration of the treatment, and after the treatment he was fine, with the treatment he was same, or he got worse, and all those things has to be mentioned in the treatment history. Hopefully you understood all these points. So in this video we have discussed about the medical history, and about the past history, about the uh, personal history, and about the family history, then about the premorbid personality, then the treatment history. So if you find our videos informative, useful for you, please subscribe to the channel as soon as possible. So thank you so much.